Hi, my name is Mecca Vadikadam. I'm your nurse practitioner and I'm going to be doing a head-to-toe assessment on you today. How are you feeling?
Feel good.
Can you tell me your name and date of birth?
Nikhil Manny, date of birth is 2/9/93.
And can you tell me where we are right now?
Paramus, New Jersey.
And can you tell me the name of the president?
It's Donald Trump.
So, I can gather from this information that your cognitive abilities are intact, your thought process is logical and coherent, your speech is clear, your mood is appropriate, calm, and cooperative, your posture is erect. I had taken your vital signs earlier, and they are all within normal range. Your body movements are normal. You appear well groomed, clean, appropriately dressed for your age, gender, and the climate, and you appear appropriately nourished. I'm gonna ask you to remember 3 words. These 3 words are pen, violet, and lion. Can you repeat those words back to me?
Pen, violet, and lion.
Okay, those 3 words I'm going to ask you to repeat back to me at the end of the exam to test your memory, okay?
Okay.
So I'm going to move forward with the exam. I'm going to begin with your skin, hair, and nails. Looking at you now, your skin is clean, dry, and intact throughout. Your skin is also warm to touch. There are no open wounds, lesions, ulcerations. Your hair is evenly distributed throughout your body. Now looking at your head and face, your face is symmetric, your head is normocephalic, your hair is evenly distributed throughout your head and your face. There are no areas of baldness, your hair is clean, shiny. I'm going to palpate your head. Do you feel any pain anywhere?
No.
Good. Palpating your head, I feel no ulcerations, lesions, open wounds. Your hair is clean and free of nits and bugs. Can you raise your eyebrows for me? Smile. Stick out your tongue. Frown. Puff out your cheeks. Good. And I'm going to palpate your temporal artery. Your temporal arteries are +2. They're elastic with no tenderness. I'm going to palpate your temporomandibular joint. Can you open and close your mouth? Move your jaw side to side. Good. And clench your teeth. Good. Your temporomandibular joint is intact. And now I can say that your cranial nerves 5 and 7 are intact. Let me just assess your sensation. I'm going to have you close your eyes. This is soft. This is dull. Just tell me what you feel, okay?
Soft. Dull. Dull. Soft.
Okay, so your cranial nerves number 5 and 7 are intact. So now I'm going to move forward with your eyes. Looking at your eyes now, your eyelids are free of edema. There are no crusts. Your eyes are free of dryness or excess lacrimation. I'm going to touch your face. I'm going to ask you to look down. Good. Look up. Good. Your sclera is white. Your conjunctiva is clear. I'm going to have you follow my pen. Okay. And I'm going to take a look at your pupils. I can say that your pupils are equal, round, and reactive to light and accommodation. Your extraocular eye movements are intact. Your eyes are free of nystagmus and oscillation. I'm going to check your peripheral light reflex. Okay, and that is intact. Now I'm going to check your corneal light reflex. I'm going to have you just take a look behind my shoulder over here. Okay. Your corneal light reflex and pupillary reaction to light is intact. I'm going to now assess your peripheral vision. I'm going to have you close one eye, and I'm going to close the same eye. You tell me when you see my hand in your visual field, okay?
Now. Now. Now.
Okay?
Now. Now. Now.
Okay, good. Your peripheral vision is intact. Now I'm going to have you, so I would do that for both eyes.
Okay.
Same with the corneal light reflex and the pupillary reaction to light. I will be doing that with both eyes, but for the purpose of the exam, I'm just doing one.
Okay.
The Snellen chart over there is about 20 feet away.
Okay.
Can you read it with both eyes open?
Both eyes open. D, E, F, P, O, T, E, C.
Okay. And can you close one eye and read it?
D, E, F, P, O, T, E, C.
And can you read it with the other eye closed?
D, E, F, P, O, T, E, C.
Good. So I can say that your visual acuity is 20/20. Okay. So that is that. Now I'm going to move over to your ears.
Mm-hmm.
So looking at your ears now, your pinna, tragus, and mastoid are even in color. They're symmetrical on both sides. I'm going to palpate. Do you feel any pain or tenderness anywhere?
No.
Okay, there's no tenderness, free of deformities. I don't see any discharge coming from either ear, or there's no swelling. I'm going to take my otoscope and I'm going to check inside your ears. For the sake of this exam, I'm just going to look inside one of them.
Okay.
Okay, so this is your left ear. I can say that your tympanic membrane is pearly gray and your cone of light is at 7 o'clock. On the right side, it would be at 5 o'clock.
Okay.
Your tympanic membrane is intact. There is no perforation and there is no discharge. Your ear canal is free of cerumen buildup or any discharge or swelling or discolorations. I'm going to assess your hearing acuity. I'm going to have you close one ear and I'm going to whisper a word. You tell me what you hear. Okay? Chocolate.
Chocolate. Chocolate.
Now the other ear, if you can close it for me.
Love. Love.
Good. And if there was, if I had any feeling that your hearing was not good, I would perform either the Weber or the Rhine test, which I will perform now. So the Weber test, I'm going to hit this tuning fork and place it at the center of your head. Can you just tell me if the sound and vibration is equal on both sides?
Yes.
Okay. And I'm going to do the Rhine test. I'm going to hit this tuning fork, place it on your mastoid bone. Tell me when you stop hearing the sound, and I'll place it in front of your ear. This is to assess your conductive and sensory neural hearing.
Okay. I hear it.
Okay.
And I hear that as well.
Well, you're supposed to tell me when you stop hearing at the mastoid, okay?
Okay. I stop hearing it.
Okay.
And I hear it there.
Good. So at this point, I could say that your hearing is intact. Okay. So now I'm going to move over to your nose and sinuses. I'm going to begin with your sinuses. I'm looking at your face. I don't see any swelling. I'm going to palpate your sinuses. This is your frontal, ethmoid, and maxillary. Did you feel any pain there?
No.
Okay, that is an expected finding. It's good that there's no pain. Now I'm going to move over to your nose. Your nose is midline. I don't see any discharge, any bleeding, any discolorations, any masses, lesions, or bumps. I'm going to take a look inside your nostrils. Okay. Your nares are patent. Your septum is midline. There's no deviation or perforation. Your turbinates and your nasal mucosa is pink, moist, and intact. Your nasal mucosa and your turbinates are pink, moist, and intact. There is no erythema, discoloration, discharge. Your mucous membranes are moist, no swelling. Now I'm going to have you close one nostril and breathe out. Good. And the other. Good. So it proves that your nares are patent. Okay. I'm going to have you just smell this. Close your eyes and tell me what you smell. Okay.
Vanilla.
Good. So I can say that your olfactory cranial nerve is intact. So now I'm going to move over to your mouth. Looking at your mouth, your lips are not chapped, they're moist and they're intact. They're not bleeding. I'm going to have you smile for me. Okay, your dentition, your teeth are intact. There's no chips, there's no unevenness, no excess growths or lack of teeth. Open your mouth wide, big, good. Your gingiva and your gums are pink, moist, and intact. If you stick out your tongue protrudes midline. It is pink and moist. Can you push your tongue against the roof of your mouth? Good. And stick out your tongue. Okay. Can you say ah? Good. Your uvula is midline, and your tongue shows strength when you're able to push it up and down. Can you move your tongue side to side for me? Okay, good. Your oral mucosa and your oropharynx is pink, moist, and intact. Your tonsils are 1+ with no erythema or exudate. There's no postnasal drip, no discharge, no growths or ulcerations of any kind. So now I could say that your cranial nerve number 9, 10, and 12 are intact. Okay? So now I'm going to take a look at your neck. Your trachea is midline. I'm going to just palpate. Do you feel any pain?
No.
Okay, good. I'm going to palpate your thyroid gland. Can you just put your chin down? Okay, do you feel anything?
No.
No tenderness?
No.
Okay. That is good. Should not be able to feel any tenderness with your thyroid gland. If I palpated your thyroid and it was enlarged, I would then auscultate for a bruit, which I will auscultate. I will just check now. Okay, your thyroid gland is negative for a bruit. I'm going to have you tilt your neck back, forward, side to side, and like this. Good. So the range of motion of your neck is intact. Can you shrug your shoulders against my hands? Good. And can you stick your tongue into your cheek and press against my hand? Good. And the other side? Good. So with this, I can say that your cranial nerve number 11 is intact. I'm going to assess your lymph nodes now. Okay, pre-auricular, posterior auricular, submandibular, submental, deep cervical chain, subclavicular. This is your temporogastromics, and occipital. Okay. Now I'm going to check your carotid arteries. I'm palpating them. They are +2. Now I'm going to auscultate them. Your carotid arteries are negative for bruit or thrill. Okay? Now I'm going to move forward over to your extremities. First, looking at your extremities right now, Your skin is intact, this hair is evenly distributed. I'm going to check for any pain. Do you have any pain when I palpate anywhere?
Your laptop.
It's okay. It's still recording. Do you have any pain when I palpate anywhere?
No.
Okay, good. I'm going to assess your sensation. I'm going to have you close your eyes. This is soft. This is dull. Okay?
Soft. Dull. Soft. Dull.
Good. So now I'm going to have you. I'm going to put something in your hand, and you tell me what you think it is. Okay?
Cotton ball.
Okay. And the other hand.
Stick.
Good. Now in one hand I'm going to write something. You tell me what it is, okay?
Egg.
Good. And in the other hand I'm going to write something else. You tell me what it is.
3.
Good. So I can say that you have the abilities for stereognosis and graphesthesia. Now I'm going to assess your vibratory sense of your fingers. If I could just have one hand, you close your eyes and you tell me which finger you feel the vibration, okay?
Pinky.
Good. And the other hand?
Pinky there too.
Good. Now I'm going to be assessing your position sense. I'm going to lift one finger up or down and you tell me which way it's going, okay?
Up.
Okay, and the other hand?
Down.
Good. Now I'm going to have you do the rapid alternating movement of your hands. So I'm going to have you in your lap go like this. Good. Your rapid alternating movement is intact. Now I'm going to assess your deep tendon reflexes. So I'm going to use this. I'm going to do your bicep, tricep. Good. Your bicep. Good. Your brachioradialis. Good. Okay. Now I'm going to be assessing your range of motion. Okay. So can you push against my hand? Good. And the other way. Good. And bend your arm up against mine. Good. And push down. Good. Now your hands down. Good. And against, up. Good. And I would do that on both sides. Okay. So I can say that you have full range of motion, 5 out of 5 against resistance with no fatigue. Okay. So now I'm going to move over to your back. So I'm going to just have you turn a little bit for me. Okay. Looking at your back, your skin is clean, dry, and intact with no abnormalities, no lesions, no ulcerations anywhere. I'm going to assess your chest expansion. Can you take a deep breath in for me? Good. Your chest expansion is equal. Can you say the words 99 for me?
99, 99, 99, 99.
Okay. You have expected tactile fremitus throughout. I'm going to percuss. All areas are resonant. I'm going to just auscultate. All lung sounds are present. Have lung sounds that are present and clear. No wheezes, rhonchi, crackles, or diminished lung sounds.
Okay.
Now I'm going to have you face forward for me. Okay, I'm going to do the same as I did in the front, inspecting your chest Your skin is even and intact with no ulcerations or lesions, no scarring. I'm going to assess your chest expansion. Just take a deep breath in and out. Okay. And can you say 99 for me?
99, 99, 99, 99.
Okay. So your chest expansion is equal and symmetrical on both sides. Your tactile firmness is expected. I'm going to percuss your lungs now, or your chest. Okay. All areas are resonant. I'm going to auscultate your lung sound now. Okay. All lobes are clear and have lung sounds. There are no adventitious lung sounds like wheezing, stridor, bronchi, crackles. I'm going to now auscultate your heart sounds.
Mhm.
So I just auscultated your aortic, pulmonic, Erb's point, tricuspid, mitral, and apical. Apical area. I'm going to palpate your left sternal border. I'm going to palpate your point of max, your PMI, and your apical impulse. Okay. So now I'm going to move forward with your abdomen. I'm going to just have you lay down for me.
Okay.
Lay down for me. It's over 12 minutes.
Keep going.
Okay. Looking at your stomach, there are no masses, lesions, ulcerations. I'm going to auscultate now. I would hold the stethoscope in each of the 4 quadrants for 5 or more minutes to assess the bowel sounds. I can say that the bowel sounds are normal active. Now, do you have any pain anywhere?
No.
If you had any pain, I would palpate and percuss that area last. So I'm going to percuss first. Your belly is generally tympanic except for the right upper quadrant where your liver is. Your liver has a more dull sound on percussion. Your spleen is tympanic and the rest of your abdomen is tympanic. I'm going to lightly palpate. Do you have any pain?
No.
I'm going to deeply palpate. Feel for your liver. Okay. Do you have any pain when I deeply palpate?
No.
Okay. Good. Okay. So now I'm going to have you get up. Are you having any issues with your bowel?
No.
Okay, good. Any issues with peeing?
Mm-mm.
Okay. So now your upper extremities, I'm going to assess your deep tendon reflexes, patellar and Achilles. Good. Your deep tendon reflexes of your upper extremity and your lower extremity is 2+, which is expected. I'm going to assess your range of motion. Can you lift up against my, your thigh against my leg? Good. And push down. Good. And push against. Good. And now down against it. Good. And can you push up against my hand on your feet and down like a gas pedal? Good. Okay. Can you rub your your heel from your knee to your shin. Okay, and the other side. Okay, good. I'm going to assess your sensation.
Mm-hmm.
This is soft. This is dull. Close your eyes and tell me what you feel.
Soft. Soft. Dull. Dull.
Good. Your sensation is intact. Now I'm going to be assessing your position sense of your feet and your vibratory sense. I'm going to do the position. You tell me. Close your eyes.
You need me to lift it up here or no?
Sure. Can you tell me if your toe is going up or down?
Down. Up.
Okay, and the other foot?
Down. Up.
Good. Now I'm going to do the vibratory sense. Tell me where you feel the vibration.
My left middle finger. Left toe, I mean.
Good.
Right big toe.
Good. So your position sense and your vibratory sense is intact, and your sensations are intact of your lower extremities. Your deep tendon reflexes are also intact. Now I'm going to have you stand up.
Okay.
Okay. And can you just walk a couple steps that way in your normal gait? Okay, and go. Okay, and then when you come back, can you just walk a little heel to toe, about halfway? Okay, and stop. And now can you hop on one foot in place? Okay, good. You can come back. Okay, so your gait, your tandem walk, and hopping on one foot are all intact. I'm going to do the Romberg test. Just keep your arms straight on each side, arms closed. I'm assessing to see if you're swaying, eyes closed. I'm going to assess if you're swaying, if you have any issues with balance. I would have you stand like this for 1 minute, but I could see that your Romberg test is negative. One more thing, I'm going to assess your capillary refill on your fingers. They are brisk. The capillary refill on your toes. They are brisk. And now can you tell me the 3 words that I told you at the beginning of the exam?
Pen, violet, line.